Number 3 is to assess operation, administration, and management of funds and other resources appropriated for them to manage the pandemic. And I'm sure you must be interested in this because it is talking about funds that have been expended. Number 4 is to assess the role of private sector health care providers in COVID-19 management. Carry out.
Uganda experienced the outbreak of COVID-19 pandemic. Government has provided a total of 4.034 trillion shillings, as summarized in Table 1 below, to fund sectors which are connected with the fight against COVID-19. In financial year 21-22, government is providing a total of 932.58 billion towards the COVID-19 interventions. The source of funding is in 3 categories as follows. 1, a total of shillings 560.84 billion was provided for in the budget for financial year 21-22, of which 80 billion is a government resource under national medical stores. Shillings 480.84 billion is external funding arising from World Bank. The funding is provided for under Ministry of Health for purchase of vaccine.
Page 12, Mr. Chairman, the Auditor General says that government has so far spent, as of June 2020, the chairman, the government had spent 5.7 trillion shillings. 5.7 as of June 2020. The minister is talking about 4 trillion shillings. So I want to know who is telling us the truth and who is telling us a lie. Mr. Minister, how much money exactly have we spent? And even then, this 4 trillion you are talking about, has government just provided it or you have already spent it? Because there is look at how government has been spending money through the Minister of Finance on police, on RDCs, on many other expenditures. But we are told by the ministry that if we spend on vaccination, it is the only permanent remedy, vaccination, and that we need about 1.6 trillion. Now we have spent over 4 trillion on what is not the real remedy.
Equipment. You talk about ventilators, you talk about pumps and so on, whatever they are called. And they are very expensive medical equipment. But they are lying idle because they lack specialized staff. But you've already invested in them and they are just white elephants all over the country. All over the country. Isn't this what you people call negative expenditure?
The 600 billions, you properly told us that the purpose is COVID emergency. And if it's a COVID emergency, I'm just worried. The COVID relief fund has been spent to president, to security, ICT, ISO, and DISO. You mean are these the COVIDs or you are going to curb COVID? Is the president COVID? Is the security COVID? Or you don't know where the COVID is?